Enabling lasting behavioral change. Evidence-based strategies for organizational implementation. Abstract. This article synthesizes research on behavioral change determinants and intervention strategies. Drawing primarily from Albarracín et al. 2024. Comprehensive meta-analysis of 147 studies. While many behavioral change frameworks focus on individual cognition, evidence suggests that high-impact interventions target access, habits, social support, attitudes, norms, and skills. The analysis reveals that structural and environmental factors often outperform information-based or attitudinal approaches. Organizations seeking to implement sustainable behavioral change should prioritize removing barriers, building supportive social structures, facilitating habit formation, and addressing practical enablers rather than relying on persuasion alone. Case examples across healthcare, sustainability, and workplace safety illustrate how these principles translate into organizational practice. The findings provide evidence-based guidance for leaders designing change initiatives that achieve lasting behavioral adoption rather than temporary compliance. Introduction. Organizations constantly struggle to implement change. Whether adopting new technologies, improving safety protocols, enhancing customer service, or implementing sustainability practices. Despite substantial investments in change management, McKinsey research suggests that nearly 70% of organizational change initiatives fail to achieve their intended outcomes. Keller and Aiken. 2009. This persistent challenge stems partly from a fundamental misunderstanding of what actually drives human behavior. Traditional change management approaches often rely heavily on information sharing, rational persuasion, and attitude change, approaches that research increasingly shows have limited impact on actual behavior. The disconnect between knowing and doing remains a substantial barrier to effective organizational change. Recent advances in behavioral science offer a more nuanced understanding of how behavior change actually occurs. A groundbreaking synthesis of 147 meta-analyses by Albarracín et al. 2024 provides compelling evidence about which factors most powerfully influence behavior and which intervention targets yield the greatest change. These insights challenge conventional wisdom about behavior change and offer organizations a more evidence-based approach to implementing sustainable change initiatives. The behavioral change landscape. Defining behavioral determinants and intervention targets before exploring specific strategies. It's important to distinguish between two key concepts in the behavioral change literature. Behavioral determinants are factors that influence whether a behavior occurs. These include both individual factors, knowledge, attitudes, skills, and social structural factors, access, social support. Norms. Determinants with higher influence have stronger associations with behavioral outcomes. Intervention targets are the specific factors that change programs attempt to modify in order to influence behavior. These targets vary in both their influence on behavior and our ability to change them effectively. Albarracín et al. 2024 research identifies 6 high-impact determinants of behavior: access to resources, habits, social support, behavioral attitudes, descriptive norms, and behavioral skills. Notably, 4 of these 6 factors are social structural rather than purely individual, challenging the common assumption that behavior change is primarily about individual choice and motivation. State of practice in behavioral change. Despite growing evidence about effective behavioral change strategies, organizational practice often lags behind the research. Many organizations continue to rely on approaches with limited empirical support, information campaigns that assume knowledge leads to action, training programs that focus on general skills rather than specific behavioral capabilities, inspirational messaging designed to change broad attitudes without addressing practical barriers. Incentive systems that overestimate the power of material rewards. This gap between evidence and practice represents a significant opportunity for organizations to improve the effectiveness of their change initiatives. By aligning change strategies with empirically validated behavioral determinants, organizations can substantially increase the likelihood of successful implementation. Organizational and individual consequences of behavioral change approaches. Organizational performance impacts. The approach organizations take to behavioral change has substantial implications for performance outcomes. Effective change implementation directly affects bottom-line results. Research from Bain & Company found that companies that effectively implement strategic and operational changes achieve, on average, 30% higher returns to shareholders than companies with poor change implementation capabilities. Centuria et al. 2008. Failed change initiatives carry significant costs beyond the direct investment in the initiative itself. These include productivity losses during failed transitions, estimated at 5 to 15% of workforce productivity, increased employee turnover, 10 to 15% higher in organizations with poorly executed change fatigue that reduces receptivity to future initiatives, damage to leadership credibility and organizational trust. Organizations that align their change strategies with evidence-based behavioral determinants consistently outperform those using traditional approaches. A study of healthcare organizations implementing safety protocols found that those using social structural approaches achieved 65% higher compliance rates than those relying primarily on education and awareness. Dixon Woods et al. 2013. Individual well-being and stakeholder impacts. The approach to behavioral change also significantly affects individuals within the organization. Employee engagement and well-being are strongly influenced by how change is implemented. Research shows that change initiatives focused on removing barriers and building supportive environments produce significantly less stress and resistance than approaches focused on individual compliance. Jimison et al. 2008. Customer experience is directly affected by employees' ability to consistently perform desired behaviors. When organizations enable behavior through structural and social support rather than relying on willpower and motivation alone, service consistency improves by up to 40%. Dixon et al. 2017. Stakeholder trust depends partly on perceived authenticity of change efforts. Organizations that align their structural environment with stated priorities demonstrate greater commitment than those that merely communicate the importance of change without enabling it. Evidence-based organizational responses optimize access and remove barriers. The research synthesis by Albarracín et al. 2024 identifies access, having the resources and opportunities to perform a behavior, as the single most influential determinant of behavior and the most effective intervention target. This finding aligns with broader behavioral science principles that emphasize making desired behaviors easy, convenient, and frictionless. Organizations can optimize access through several evidence-based approaches. Simplified processes and reduced friction. Eliminate unnecessary steps in workflows. Provide tools and resources at the point of decision-making. Redesign physical environments to make desired behaviors the path of least resistance. Reduce competing demands that drain attention and cognitive resources. Technology enablement. Deploy digital tools that automate routine decisions. Create just-in-time support systems that provide guidance when needed. Use mobile solutions that make resources accessible anywhere. Resource allocation. Ensure sufficient time allocation for new behaviors. Provide adequate staffing to support transition periods. Invest in infrastructure that supports desired behaviors. Patagonia transformed its sustainability initiatives by focusing on access rather than persuasion, instead of merely encouraging employees to reduce waste. The company completely redesigned its facilities to make sustainable choices the default. They replaced individual trash cans with centralized recycling stations, introduced compostable packaging in cafeterias, and installed water refill stations throughout facilities. These structural changes led to a 67% reduction in landfill waste without requiring significant effort from individual employees. Foster social support and normative influence. Social support, receiving help with performing a behavior, and descriptive norms, knowing that others are performing the behavior, both rank among the most powerful determinants of behavior according to Albarracín et al. 2024 analysis. This reflects humans' fundamentally social nature and our tendency to look to others for guidance on appropriate behavior. Organizations can leverage social influence through several evidence-based approaches. Peer learning networks. Create communities of practice around new behaviors. Establish buddy systems for skill development. Facilitate structured peer feedback. Social proof mechanisms. Make adoption visible through public commitments. Share success stories and examples of implementation. Provide data on adoption rates across teams or departments. Leadership modeling. Ensure leaders visibly demonstrate target behaviors. Create opportunities for leaders to share their learning journey. Connect leadership evaluation to successful behavior modeling. Cleveland Clinic revolutionized its patient experience by harnessing social influence to change provider behaviors, rather than simply training staff on new service standards. They created a comprehensive social system to support behavioral change. They established unit-based, experience teams, where peers supported each other in implementing new approaches. Shared regular data on patient satisfaction by department to create positive competition. And required leaders to conduct regular, experience rounding, where they modeled desired behaviors. Within 3 years, patient satisfaction scores rose from the 55th to the 92nd percentile nationally. Molino and Rahman. 2013. Build habits through environmental design. Habits, established routines that occur with minimal conscious deliberation, emerge as both a powerful determinant of behavior and an effective intervention target. The power of habits lies in their automaticity. Once established, they require minimal cognitive resources to maintain. Organizations can facilitate habit formation through several evidence-based approaches. Implementation intentions. Help individuals create specific if-then plans. Link new behaviors to existing routines. Identify specific contextual cues that will trigger the behavior. Practice and repetition. Create structured opportunities for repeated practice. Start with simplified versions of behaviors before adding complexity. Provide immediate feedback during early implementation. Environmental cues and triggers. Redesign physical or digital environments to prompt behaviors. Use visual reminders at the point of decision. Incorporate nudges that guide toward desired actions. Kaiser Permanente dramatically improved hand hygiene compliance among healthcare workers by focusing on habit formation rather than education. The organization had previously relied on awareness campaigns about infection risks, with limited success. Their new approach redesigned the physical environment to support habit formation, placing sanitizer dispensers directly in the workflow path, installing visual cues at entrances to patient rooms, and creating hygiene zones with colored floor markings. They also established a routine where team members would sanitize hands together at the beginning of shifts, creating a social ritual. These interventions increased hand hygiene compliance from 47% to 91% within 4 months, significantly reducing hospital-acquired infections. Shrigley et al. 2015. Develop specific behavioral skills. Behavioral skills, having the specific capabilities needed to execute a behavior, rank as a high-impact determinant and effective intervention target. The research distinguishes between general skills, broad capabilities, and behavioral skills, specific abilities tied to particular actions, with the latter proving far more influential. Organizations can develop behavioral skills through several evidence-based approaches. Microskills training break complex behaviors into specific component skills, provide focused practice on individual elements, build from simple to complex applications. Performance support tools create checklists and decision aids, develop reference materials accessible at point of need, design templates that guide proper execution. Deliberate practice structure practice activities with increasing difficulty, provide immediate, specific feedback, create opportunities to apply skills in realistic contexts. Adobe transformed its performance management system by focusing on developing specific conversation skills rather than broad management capabilities. When introducing a new continuous feedback approach to replace annual reviews, they recognized that managers needed concrete skills for holding effective feedback conversations. They developed a micro-skills training program focused on specific conversational techniques, asking open questions, using non-judgmental language, creating action plans, and provided conversation guides for different feedback scenarios. Managers practiced these skills in simulated conversations with immediate feedback. This skills-focused approach led to a 30% reduction in voluntary turnover and significantly higher engagement scores within 18 months of implementation. Buckingham and Goodall. 2015. Align attitudes and motivation while not as powerful as structural and social factors. Behavioral attitudes, evaluating the behavior positively, remain significant determinants of action. The research suggests that attitudes specific to the behavior itself have greater influence than general attitudes or broad beliefs. Organizations can effectively align attitudes with behaviors through several evidence-based approaches. Personal relevance connect behaviors to individual values and priorities, highlight direct benefits to the individual, create opportunities for personalization of approaches. Autonomy support provide rationale for requested behaviors, offer meaningful choices within the change process, acknowledge difficulties and validate concerns. Feedback systems create tight feedback loops between behavior and outcomes, make progress visible and meaningful. Celebrate incremental achievements. Starbucks successfully improved customer service behaviors by focusing on specific behavioral attitudes rather than general motivation. The latte method training helped baristas develop positive attitudes toward handling difficult customer interactions by connecting these behaviors to their personal values and providing a structured approach. Listen, acknowledge, take action, thank, explain. The company also implemented a system where baristas received immediate feedback on customer interactions and recognition for positive service moments. This approach led to a 15% increase in customer satisfaction scores and reduced employee turnover by creating more positive attitudes toward challenging aspects of the job. Schultz and Gordon. 2011. Building long-term behavioral change capability. Create structural enablement systems. Organizations that successfully sustain behavioral change move beyond individual interventions to create comprehensive systems that structurally enable desired behaviors. These systems integrate multiple determinants of behavior to create environments where desired actions become the default. Key components of effective structural enablement systems include integrated design processes that consider behavioral implications when developing physical spaces, workflows, policies, and technologies. This approach embeds behavioral supports directly into organizational infrastructure rather than adding them afterward. Behavioral governance mechanisms that evaluate existing and new policies, procedures and systems for their impact on target behaviors. These mechanisms help identify and remove structural barriers while reinforcing enablers. Continuous feedback loops that gather data on behavioral patterns, barriers, and enablers to inform ongoing system refinement and adaptation. Develop distributed behavioral leadership. Sustainable behavioral change requires leadership at all levels of the organization. Rather than centralizing change responsibility in formal leadership or specialized departments. Effective organizations distribute behavioral leadership throughout the system. Key elements of distributed behavioral leadership include local champions networks that connect individuals across the organization who have responsibility for supporting behavioral adoption in their areas. These networks facilitate knowledge sharing, problem solving, and adaptation of approaches to local contexts. Peer influence systems that formalize the role of social support in behavioral change. These systems might include peer coaching programs, communities of practice, or structured mentoring relationships. Frontline empowerment that gives those closest to the work authority to identify and remove barriers to desired behaviors. This approach recognizes that behavioral enablers often differ across contexts and require local adaptation. Build continuous learning and adaptation capabilities. The most effective behavioral change approaches evolve over time through deliberate learning and adaptation. Organizations that sustain behavioral change develop systematic ways to learn from implementation and refine their approaches accordingly. Key elements of behavioral learning systems include implementation monitoring that tracks not just outcomes but adoption patterns, barriers, enablers, and variations in practice. This monitoring helps identify what's working, what's not, and why. Experimentation frameworks that encourage small-scale testing of behavioral interventions before broader implementation. These frameworks help organizations learn what works in their specific context rather than relying solely on external evidence. Knowledge management systems that capture and share insights about effective behavioral change approaches across the organization. These systems prevent reinvention and accelerate learning from both successes and failures. Conclusion. The evidence synthesized by Albarracín et al. 2024 challenges conventional wisdom about behavioral change and offers organizations a more effective approach to implementing sustainable change initiatives. The research clearly demonstrates that while knowledge and general attitudes play a role in behavior, the most powerful determinants of action are access, habits, social support, behavioral attitudes, descriptive norms, and behavioral skills. For organizations seeking to implement lasting change, these findings suggest several key principles. 1. Prioritize enabling infrastructure over persuasion. Make desired behaviors easy, convenient, and supported through environmental design and resource provision. 2. Harness social influence systematically. Create formal mechanisms for peer support, social learning, and normative influence rather than treating these as incidental factors. 3. Design for habit formation. Identify specific contextual cues, create implementation intentions, and provide opportunities for consistent practice with feedback. 4. Focus on specific behavioral skills rather than general capabilities. Break complex behaviors into component skills and provide targeted development with deliberate practice. 5. Build comprehensive behavioral enablement systems that integrate multiple determinants of behavior into organizational infrastructure. Organizations that align their change strategies with these evidence-based principles will not only achieve higher rates of behavioral adoption but will also build lasting capabilities for implementing future changes. In a business environment where adaptive capacity increasingly determines competitive advantage, the ability to effectively enable behavioral change represents a critical organizational capability.